Health Secretary, at the outset of this pandemic, did you ever imagine sitting here with 44,500 people who've sadly died from this virus in the UK?
Well, right from the start, it was obvious that this pandemic was going to be very significant if it came out of China, and it did. And, I remember being told the estimate that 500,000 people would die, and we took the action that was needed with the lockdown in order to prevent that. And all the way through, we've been working to try to control the virus. And thankfully, it is now very largely under control. We're clearly through the peak, but also it's in retreat across the country. And in those parts of the country where there's still a significant level, we're able now to take much more targeted and direct action, as in Leicester, but other places too.
It is a huge responsibility that you've had to shoulder. 44,500 people have died. Is that a number that keeps you up at night?
Well, that's not how I think about it. I think about what we need to do now for the future and what we can learn from the past and everything that's happened, both here and around the world. But, I wake up every morning and think, what do we need to do now? Thankfully now, the number of people dying each week is lower than in a normal June. That's partly because there's less traffic on the roads and things are safer in normal life, if you like. And because we've been able to bring the virus right under control. And I'm also thinking now about the future in terms of protecting the NHS. For instance, over winter, we protected the NHS in the peak. I think that's been one of the things that people were very sceptical about whether we'd be able to stop the NHS from being overwhelmed, and we succeeded in doing that. And now, but I don't really think about that. That was one of the successes. I don't think about that. I think about what do we do for the future, and how do we protect the NHS in the future. So I'm quite a sort of forward-oriented person, and I get up in the morning and I think, what do we need to do next?
If you could give yourself an honest appraisal of what went right and what went wrong during the pandemic, what would your reflections be?
Well, I think that we took some extraordinary decisions and had to take them very, very rapidly. I think that we've learned an awful lot about the virus itself, the science of the virus, because if you think about it, 6 months ago, nobody even knew that it existed. We've learnt about that. We've also learnt about the sorts of things that you need to put in place. There's some things that we got wrong first time and had to change. So one of the things I was really struck by was that the way people interpreted the guidance around funerals in the peak, when there were a lot of funerals, and people, it wasn't intentional, but it was the way that people interpreted the guidance was that loved ones, even husbands and wives, couldn't go, and we changed that. And we tried to get through this in a way that is as damages as little as possible, both the economy and just the things that really make life worth living. And it's been hard to get that balance right.
The performance of the UK will be measured against other countries. Why do you think the death rate in England is higher than anywhere else in the developed world?
Well, I think there'll be a time to assess how different countries have performed. It's not actually, what you said is not actually the case, but that's, in a way, that's immaterial. What matters now is how we ensure that we keep the virus under control and recover as much of what makes life worth living, and make sure that people's livelihoods are protected too. Now that it's right under control. Of course, it's very important learning from the peak and learning from the experience of all the different countries, but there'll be a time for that. But right now, I'm concentrated on what comes next.
When you look at the statistics, it is the case that England does have the highest death rate in the developed world. Why do you think that is? There must be some things that you reflect on and think, well, maybe that could have been done differently. Maybe we should have locked down earlier, for example.
Well, as I say, it's not the case, the statistic. in terms of the UK performance. But nevertheless, whatever the statistics, what matters is making sure we're as well prepared as possible for what comes next, and in particular for over the winter months when the NHS is always under more pressure.
There were some pretty dark moments during the pandemic. What do you think was the darkest day for you?
Well, obviously I was ill myself. At the same time, the Prime Minister was ill and then was in hospital. It was difficult. The hardest time, without doubt, was after we brought in the lockdown, when the numbers were still going up, and we knew that the impact of the lockdown would have an impact in a couple of weeks' time, but we didn't know how much of an impact. Now, I'm really glad to say the impact was that it brought the virus, it flattened the curve. But in that period, when we'd done everything we could and we'd thrown everything at it, but before we knew that would flatten the curve, that was difficult. And it was difficult because we'd taken the actions that a government can take, and the country had responded. Right, the whole country embraced lockdown when everybody was asked to, and thankfully the curve did turn.
What was it like having coronavirus and trying to lead the biggest response to a pandemic in our lifetimes?
I worked from home all the way through the time I was ill. There were a couple of days when I couldn't eat, I couldn't swallow. My throat was like I had glass in it, and but there was so much that had to be done that we carried on working through it, and thankfully I recovered.
We're sitting down today as the true economic cost of the pandemic is beginning to become clear. £15 billion on PPE. Do you think Britain's being overcharged for that PPE?
Oh no, not at all.
You don't think that maybe we're paying over the odds because we didn't stockpile in the first place?
No, we had a huge stockpile and we worked our way through it, and then we had to replace it. No, I'm incredibly proud of the effort that the team has gone to in supplying PPE. We had that period in the middle when the supply was really tight, but there was at no point at which we had a national shortage.
But £15 billion is an astronomical figure for people to get their heads around. It's more than the Home Office's budget. Are you sure we're not being ripped off, that we're paying over the odds?
No, I'm absolutely sure that we have done the right thing to get PPE for people who are on the front line protecting us. And we had a huge PPE stockpile. We had 1 billion items of PPE. We obviously ran through that stockpile and we were buying it, but we were buying it at the same time as demand from everywhere else around the world.
Which did push up prices, so perhaps if the stockpile had been larger to begin with, we wouldn't be paying this much for it.
Well, we had one of the biggest stockpiles in the world. We'd in fact increased the size of the stockpile because of Brexit, in preparation in case of a no-deal Brexit. So we had a huge stockpile on anybody's terms. And then whilst we were working through that and using it, we then had to buy more. And there was a period when the whole world was trying to buy, and you'll remember the big debate in public about it, but we managed to avoid a national shortage at any point. There were difficult issues in individual hospitals and care homes, but we didn't have a national shortage. And now we're rebuilding that stockpile. But it's true, the prices went up. It's a matter of supply and demand. But do I regret buying PPE for nurses on the front line and for people who work in care homes and for the doctors doing their life-saving surgery? No, I do not.
£15 billion for PPE, £10 billion for test and trace. Are these numbers that should warn people that we are heading for a second wave, that we should be prepared for a significant second wave?
Well, no, I don't think that the figures, the costs of these things have an impact on whether we're having a second wave. What they show is that we are doing what is necessary in order to protect the people who care for us through PPE and also through test and trace. You know, most of that money goes on buying test kits, which are obviously absolutely critical to knowing where the virus is and getting it under control. And you'll have seen from the test and trace figures that came out today that test and trace is increasingly working and working really well. Those test turnaround times have come right down, and test and trace is managing to get hold of a bigger and bigger proportion of the people who've got it. And this is how we increasingly control the virus instead of the national lockdown.
When do you expect a second wave to hit the UK?
Well, I very much hope there won't be one. So people talk about the second wave as if it's something that's inevitable. We do see spikes. Right? We've seen in Australia, they thought that they'd more or less got rid of it, and then there's been a spike and they've locked down Melbourne. We're seeing this we've seen it in Leicester, where the numbers started to come down and then shot up again, and the national government had to go in and sort that out. Undoubtedly, the most difficult time is in the winter, when the NHS is under pressure anyway, both because we know that the virus transmits less outdoors, and it's naturally harder to be outdoors in winter, and secondly, because there's some evidence that the virus transmits more easily in cold environments. And so, that is undoubtedly going to be a challenge, but there's no inevitability to it so long as people keep following the social distancing guidelines.
Do you think half-price takeaways are the best way to get Britain fighting fit for a second wave?
Well, that's just one measure in a whole package that Rishi Sunak's brought in.
But do you think people should be trying to be healthy ahead of a second wave and potentially slimming down? I mean, the Deputy Chief Medical Officer suggested they should lose weight.
Well, yes, it's very clear that obesity is correlated with a big impact of coronavirus. But at the same time, our hospitality industry employs millions of people, and we need to make sure that it gets going in a COVID-secure way. The world, the new normal, the world is going to change, and the new normal is something we're going to have to get used to. And actually, I think we've got to make sure that the world we build, the society we rebuild from this, the economy that comes back from the ravages of coronavirus is a better one. It is one where we can use technology to see loved ones. We don't have to travel as much for many business meetings. Many people, for instance, we need to. We need to make sure that the good things that have happened amidst the crisis, and there have been good things, we make sure we hold on to those.
At ITV News, we've been really focused on the crisis in care. When did you first decide to prioritise the NHS over the care sector?
Well, the care sector was prioritised all the way through this.
Care staff got testing after NHS staff. Care staff got PPE after NHS staff. They weren't a priority, were they?
Well, that's wrong, actually, Paul. So the residents in care homes who had symptoms have had testing throughout this in the same way. 5 residents per care home could get tested. It wasn't blanket testing, and the staff did not get the same testing as NHS staff until much later in the pandemic. No, that's not right. It was residents in care homes. Of course, once you had an outbreak in a care home, then it was highly likely that somebody else with symptoms also had coronavirus. So that was following the clinical advice. And we put in £3.2 billion into the care sector right at the start. And what matters is if you look at the outcomes. Now, of course, people in care homes are there because they are frail, and my heart goes out to those the families of those who we've lost. But the proportion of people in this crisis who have died in care homes in this country is lower than any other European country. So yes, it's been a huge challenge, and I pay tribute to care home staff who've done so much. But we have managed to protect more people in our care homes than other similar countries. Having said that, is there more that we can do as we've learnt about the virus on the way through? Yes, and as we learnt about the virus, so we brought in more measures in the same way as we did in hospitals and every other part of society.
You did test later in care homes than in the NHS. You did provide PPE much later in care homes than in the NHS. Can you give me a single example of when the social care was prioritised over the NHS? It always played second fiddle, didn't it?
No, it's comprehensively false, this accusation. And I think that one of the...
It's what carers tell us. Carers feel as though they were treated as second-class citizens. They said those words to me.
I think one of the good things about the crisis is that whereas before, going into the crisis, a lot of the public saw the NHS as as an incredible service, and it is. The same now is the view of social care and the people who work in it, and I think that's wonderful.
Do you honestly think you treated social care in that way from the outset?
Yes, I absolutely do.
On day one, you said social care is the same priority as the NHS.
Yes, and if you think about it, we put the finance in, so that they had the financial support. We did that right at the start.
It was mentioned twice, social care, in all the SAGE meetings in 5 months.
Well, it's not a matter. I haven't seen that, but what I have seen is what we did as a department. It doesn't matter my scientific advisors. We make decisions that are guided by the science, but ultimately it's we who make the decisions and take responsibility for them. And I've had advice on what we needed to do in care homes all the way through. This is why we put the funding in right at the start, and why we've taken increasing action as we learnt more about the virus.
Carers say one of the biggest mistakes of this pandemic was discharging hospital patients into care homes without testing. Why did you ever think that was okay?
Well, it's incredibly important that people get the right care in the right place. And
why not just test them, though? It's a no-brainer, isn't it? You should test people coming out of hospital going into a care home.
Well, the reason for that decision is that what the science knew, and this is no criticism of scientists, because it was what the best knowledge of the virus at the time, was that there wasn't asymptomatic transmission. So if somebody had symptoms, then of course they got the test, but the advice was that if you didn't have symptoms, then you couldn't transmit the virus. Now that's because all previous coronaviruses have been like that. Now we know that asymptomatic transmission is a very significant thing. And as soon as we found that out, we made changes to the way that and had this testing for everybody as they left hospital. Now you've also got to look at the scale of this, because the number of people who left hospital and went into a care home fell markedly.
Well, the number of people leaving hospital going into any environment fell during the crisis because sadly people were dying. 25,000 people were discharged into care homes in 1 month in England. They weren't tested, most of them.
Well, as I said, the proportion actually was falling, and it's not the reason that you sat out. It's because we took people who could clinically be discharged from hospital, and in the very large part, they went home with a care package at home, and it is true, 3% went from hospital into care homes, and they had infection control procedures in the care home. So, of course, controlling a virus is very, very difficult, and controlling a virus that spreads asymptomatically is even more difficult still, and that has been, I think, at the root cause of why this is such a difficult virus to control. But thankfully we've got it under control, and I pay tribute to the care home sector for the fact that in this country a much smaller proportion of people died in care homes than in any other European country, and that shows that whilst this has been difficult, the staff who work in care homes and those who run care homes have done a remarkable job.
We discovered in the course of our investigations that beds were actually block booked in care homes by the NHS, by councils. It was always the plan, wasn't it? You always wanted to take patients from hospital, whether or not they had COVID-19, and put them into care homes.
Well, we always, what is true in that area is that we always had the infection control procedures put in place in care homes, and we strengthened them throughout.
But care homes didn't know, in many cases, whether or not these patients had COVID-19. You were putting them into a high-risk environment. Well, people want to know why on earth you did that.
No, this isn't right, Paul. This isn't the way that it happened, because what happened was that there was infection control put in place in care homes, and you have to look at what is right for an individual. And being in a hospital, especially if you're frail, is a very risky place to be, and people deteriorate in terms of their health if they're kept in hospital too long when they don't need to be clinically.
I appreciate that, but then the question is why you didn't test them. It does come back to why you didn't test these patients leaving hospital. It could have saved thousands of lives.
The truth is that around the world, people didn't know that there was the asymptomatic transmission.
And the scientists in the UK were discussing that in January. Chris Whitty discussed it in March. You did know that there was a potential for asymptomatic transmission.
As soon as they certainly discussed it earlier, and they came up with the advice that it didn't happen. Discussing it is different from concluding it. The advice, of course, you have to base your policy on the best available science, and that's what we did.
This week, the Prime Minister suggested that care homes were at fault for not following the correct procedures, and we've spoken to one carer, Debbie Adams, who just really wants an apology for that. I understand you've clarified the remarks. I understand they were not your remarks. You didn't make them. Can you just give Debbie Adams the apology that she wants?
Well, what I can say to Debbie Adams and frankly everybody who works in social care is that the point that the Prime Minister was trying to make is that we didn't because the science hadn't taken into account asymptomatic transmission. That meant that the guidance didn't reflect that.
I understand that clarification, but can you just apologise? That's what she really wants.
Well, what I can do is I can tell Debbie and all those who work in care homes that the point that he was trying to make, and I can also say how much we value their work and everything everything they've done to keep people safe. I mean, people in social care have gone to extraordinary lengths to keep people safe, and to do that infection control, which is at the root of protecting people, which is why the care homes in this country have done better than anywhere else in Europe.
After everything that carers have been through, after everything that they've done for people, we can't keep paying them minimum wage, can we?
Well, I'm a massive fan of the fact we've increased the living wage. Firstly, introduced the living wage and then increased it. And I think that social care is an incredibly important job. And so I look at the big pay rise that there's been from 5 years or so ago when the living wage was introduced to now, and I'm very proud that we've done that, and we've done that by legislating for it. It's one of the things I'm most proud of voting for, and I can't make a financial announcement now, but I think you can see where my heart lies.
You do think that they probably deserve a pay rise?
Well, I think it's a really important and valued job, and I'm really proud of the increase in the living wage that we've introduced that has had more of an impact on the care sector than almost any other sector, and I want to see that go further.
This pandemic's also raised serious questions about reforming social care, which I know that you've been thinking about a lot. When can we expect these reforms to be put into action?
Yes, it's absolutely critical. The reforms of social care that have been long overdue and that governments of all stripes have ducked concluding on. I've been trying to drive through in my 2 years in this building as Secretary of State for Social Care, and the Prime Minister is equally determined. We were making significant progress before the crisis struck. The crisis had demonstrated yet again how important it is. In fact, nothing has demonstrated the importance of social care more than the coronavirus peak, and we are absolutely determined to solve this once and for all.
When 5% of care home residents have died from COVID-19, it's just not true to say you put a protective ring around it, did you? It's not a fair description. It's not how care homes feel about it.
Well, we started by putting a significant amount of extra funding in. And we also ensured that the availability of PPE, which is a very significant challenge, that got sorted. It was very difficult at first, and
you gave them 300 face masks to begin with.
Well, the first thing we did was we managed to get an immediate drop of PPE, and then we got more and more out to care homes. It was a huge logistical undertaking, and that flow is now in much better shape. And of course, as the evidence of the impact of the virus, as we learn more about it, so we strengthen the guidance around care homes as well. And care homes have played an incredibly important role, not least because they do look after the most vulnerable, and people naturally go to a care home. The reason that you go is because you're vulnerable, and if you're older, it's because it's towards the end of your life.
Let's finish on some good news. When can relatives see their loved ones in care homes again?
Well, I've been really struck by the pictures I've seen of people being able to see their loved ones through glass, or some of the incredibly innovative approaches that care homes have taken to make sure that the families can see their loved ones in care homes. We've been very, very careful to ensure that visitors don't bring coronavirus back into a care home. But in the next few days, we will be setting out how COVID secure visiting can happen in care homes, how we can have more visits of loved ones in a way that is very careful and in a way that keeps care homes safe. There'll be more details soon, but this I think that people are yearning to see their loved ones, and the residents of care homes get so much from visitors. It's been a very, very long period, and that period when there hasn't been any visiting allowed to care homes, that's coming to an end very soon.
So do you think people will be able to see their relatives next week?
I very much hope that in the next few days we'll be able to make this change. We've been understandably, I hope you understand, we've been very careful about it, and we've got to get it right. We've got to make sure it works for each local area, but I hope that we can make that change very soon.